Was asked to share some thoughts about supervision, especially EMDR, clinical supervision or consultation. And I'm really happy to do that. So I just wanted to, first of all, talk a little bit about what I received when I was under consultation that I really tried to carry forward. Um, I've gotten consultation from many people in my life, but my close colleague, Annie Monaco, was actually the person who did my EMDR consultation back in the day, which was quite some time ago. And I had been a rather reluctant convert to EMDR. I was first a play therapist, so I've really made my career working with children. And I was trained as a play therapist, play therapy trainer myself. And have a lot of respect for spontaneity and creativity, narrative, imagination, and how we can use all of that in therapy. And then along came EMDR training, and the protocol seemed rigid to me. It seemed very adult oriented, which of course I was being trained in the adult standard protocol, so that makes sense. What I loved about the work with Annie that I did back in those days was encouraging me to listen to my own instincts and to listen to my own body as we do trauma work with any age, but especially with children, because they're not as able to verbalize what's going on for them in the processing. Also, they sometimes need help from us, and they may need more. They may need more freedom, more flexibility to be themselves, to be children. And so, what that gave me the freedom to do was to start integrating, especially as I mastered the basics of the standard protocol. Then I was able to start innovating and integrating some of the other tools that I had available. And really, that's led to all kinds of things for me and for my clients in terms of being able to, do this work with fidelity, with authenticity and, good information about EMDR, but really also in a way that's congruent and available to children. So that advice to listen to my own clinical instinct, even though you want to master tools, you go to trainings, right? And you rehearse things and you practice them over and over again. We don't want to look silly or foolish in front of our clients, and we don't want to do harm. But I think what that really taught me to do is to make sure that I didn't do harm with inaction. And so that's been really good advice for me. And I've tried to carry that then forward in my own consultation work. So I have a training program, and I also work with consultants in training. So now it's become kind of two layers of supervision, which is very exciting. Because really the goal here is to get more and more people who are trained in EMDR to use it with their child clients. There's lots of kids in therapy who have trauma and whose therapist has been trained in the basics of EMDR, but who is not receiving EMDR because it's really, really challenging to get there. And especially for the kids who need trauma work the most, which are the kids with complex trauma, attachment wounds, and those sorts of things. So some of the things that I have tried to kind of carry on and carry to people, first of all, if you're going to be good at this work, especially with children who can be challenging, especially with teens who can be really challenging, the first thing we have to do is take care of our own instrument. We are the tool of our trade. So, I talk to people about self-care. I talk to people about how training and consultation itself is a form of self-care, an investment in your own capacity. When we feel less helpless, we're less likely to burn out. But then also setting boundaries around work hours, making sure that we find time to do our own playing and our own work, our own trauma work if need be, because, we're going into a very demanding and active kind of work when we're trying to do trauma processing and EMDR processing with kids. In particular, which is most of my consultees, although I also see adults and have over the years, but a lot of people are very particularly looking for that advice about how to be ready for what comes up in the room with children. So self-care, including investing in your own learning. I think are two pieces of that. And then the other is to really just try to develop a confident self that is brave enough to lead children towards pain and towards hard things. Really, all of our instincts, all of our neurons collaborate to oppose this. Even though I've been doing this work for many years now, it hasn't really gotten any easier to bring a child over the bridge into phase 3. And so I try to normalize that fear and that reluctance that we feel as therapists, but we also have to weigh that against the need and the fact that if we wait and delay and if we stay in perpetual preparation phase, we're denying children the evidence-based treatment for their traumatic and post-traumatic symptoms. So we have to find a way to, you know, do it bite by bite. We have to find a way to intersperse play. And we also have to find a way to kind of sell ourselves on the idea that if we can get into that trauma memory network and help kids regulate and maintain dual attention as they do that exposure work, obviously using parents when we can, caregivers, interweaves, all kinds of, I use a lot of kind of integrative tools like sand tray and physical movement, dance, running around the room as ways to kind of regulate through that. What we find is if we can do even a little bit of that work, it does make a difference. And so that's really my main focus as a supervisor right now, is helping the therapist to take the moderate amount of risk that it takes in order to get kids doing trauma processing. And to, obviously do that with support. Anyway, I welcome the chance to talk about all this. I'm Ann Beckley-Forest. My training business is Playful EMDR. I'm on the web at playfulemdr.com and annbeckleyforest.com. And I love this conversation. So thanks for asking the question.